500 people are hospitalized in El Paso due to COVID-19. El Paso is breaking several records today as the number of cases continues to climb.
Health officials say there are 496 total patients hospitalized. That's up by 30 from yesterday. 134 patients are currently in the ICU and 64 people are on ventilators.
So let's take a look right now at the hospitalization rate in El Paso. It's the number on the bottom left-hand corner of your screen. It's up to 33%. That means 1 out of every 3 El Pasoan hospitalized has COVID-19. The El Paso City County Health Authority did not mince words today with county commissioners, calling the situation dire.
Unfortunately, we are in a different situation right now compared to the other bigger cities in the state of Texas, in which they're not seeing this sharp increase that we're seeing right now. So we need to stick together as a community and do something about it. We cannot afford to be in lockdown anymore, but we need to be careful and strategically placing those restrictions.
This is exactly what Dr. Ocaranza is referring to. This is the state dashboard for COVID-19. The El Paso trauma region is in Trauma Service Area I, which you can see here. It encompasses not just El Paso County, but also Culberson and Hudspeth counties. And you can see we are the highest. It is this purple bar right here. This is the entire rest of the state with all the other regions. You can see only 2 other regions across the entire state are even above that 15% threshold. Now, they're expected to become, I should say that officials told county commissioners that additional testing resources from the state are coming to the county, and they're expected to be online by mid next week. But you can see where El Paso is in relation to everyone else. And when you take out Hudspeth and Culberson counties, that's when you get to that 33% mark, which is astronomically higher when comparing it to the rest of the state, Stephanie.
And Eric, if you were watching World News Tonight before this newscast, you may have noticed El Paso came under the national spotlight because of the increase in COVID-19 numbers. What you may not have seen is Mayor DeMargo telling the ABC News correspondent how some of those rising numbers may be due to area bars. ABC 7's Saul Saenz has part of that interview and joins us live. And Saul, why does the mayor believe bars could be to blame for the rising cases?
The commission gave some bars the green light to reopen by simply requiring bars to have food available on the premises, even if it's just a food truck. ABC correspondent Matt Gutman asked the mayor why El Paso is seeing such a huge increase in cases. The mayor says the spike in positive COVID-19 cases involve people most likely to go to bars, people between the ages of 20 to 39 years old. Bars that find ways to open up and don't follow all the rules is leading partly to community spread. He says people in that age group may be going through COVID fatigue and heading out to bars, adding that's why we're seeing such a huge spike in positive cases through community spread.
The thing is, I think some of them are gaming the system where we have anecdotal evidence of you walk in and buy a beer for $1 and nachos for 15. You know, I mean, it's just, and I think that's where the majority of our problems are occurring right now. Our bars, supposedly now restaurants, gaming the system.
And why do you think it is that people are so reluctant to wear masks, that they want to go to bars, that they're partying so much, especially young people?
Well, I think they're probably wearing the mask before they go in, but they're taking them off when they have the alcohol and conversing, and that's where the spread is. It's community spread.
Now, according to TABC rules, bar sales receipts must show they're selling more food and other merchandise and liquor in order to stay open. Eric?
All right.